Hello everyone, I'd like to welcome you into a new webinar session with yours truly, Charles. Today I'd like to discuss one of the most controversial topics in medical insurance, pre-existing conditions. There's always a question, is it covered, is it not covered? Now this topic also raised most of the clients' complaints in discussion. That's why I find it very necessary to speak about it. Please lend me your ears and eyes and hope this session will educate you as to how to educate your clients when they ask about PEC. Now here are the objectives of this presentation. I'd like you guys to understand the types of medical conditions, understand the relevance of pre-existing condition with medical insurance, types of underwriting guidelines, repercussions or results of declaring and not declaring pre-existing conditions. How can a pre-existing condition be covered? Requirements to cover pre-existing conditions, and most of all, promote client awareness and better advice. I'd like to discuss basics. Let's talk about medical conditions. Now, medical conditions can be positive or negative. However, I'll be discussing the abnormal conditions that negatively affect the structure or function in one's body. These are the samples: viral and bacterial. For example, flu, cold, or the ever famous COVID-19. These are often tagged as acute conditions. These are severe and sudden in onset. Happens right away, usually covered under medical insurance if did not turn to a chronic condition. Chronic condition, by contrast, is a long developing syndrome such as diabetes or hypertension. So it's a continuous disease that the member can be experiencing throughout his life. Now, to go back to my first ever webinar where I talked about international medical insurance and the Dubai Health Authority health insurance law. It's mandatory to have all Dubai residents to have medical insurance in place. Maternity must be covered, and number 3, pre-existing conditions must be covered. The pre-existing condition is a medical condition that started before a person's health benefits went to effect. So before they take out the medical insurance, they had these conditions before the policy start date. So that's what we call pre-existing condition, whatever that is. Now, you might ask, what if I don't know if I had pre-existing conditions? Some clients tell this. Now, pre-existing conditions can be known and unknown. It is advisable to visit a doctor and have a general checkup before applying for medical insurance, especially if you're experiencing uncommon issues within your body. Whatever you don't know will not help, as whatever happened within your body before you take out the policy, it can be a reason of a denial of a claim, and 100% the doctors will know. Now, stating pre-existing condition can be like a tough task for clients, because everybody knows right now that if you declare pre-existing condition, an increase in premium will be seen. Now, these are the types of underwriting. These are the type of pricing in terms of medical insurance to clients. There's this what they call full medical underwriting. Usually these apply to individual, family, and small group application. Now, if you go on full medical underwriting, you'll be asked to submit an individual application form. And if there's any pre-existing condition or any medical condition that you answered in the application form, you'd be requested to submit related medical reports. That includes treatment plan and medication. And for some insurance companies, they'll ask for a full wellness check for overage members. Now, I'm sure you guys have seen this. This is just one of a few individual application forms. Now, these will be the questions that you'd be seeing. You guys can read through it. If you guys want a copy for your reference, just let me know. So whatever you put on yes on these questions, you'll be asked to submit, again, related medical reports, treatment plan, and medication. This will be used to examine and understand how much the increase in premium will be. Another type of underwriting is what they call medical history disregarded. Now, this would apply to bigger groups. From 11 employees, however, varies from different insurers. Some insurance company will ask 20 employees. Some insurance company will ask 30 employees to have this benefit. Now, if you have a group that has a benefit of having medical history disregarded, not all the members will be asked to submit an application form. A group medical application form, however, will be a requirement. Now, insurance companies would still take care of themselves and make sure that they won't lose much if they acquire any individual or even group. Now, group application form has been introduced last year by most insurance companies, and they're asking critical chronic conditions like cancers, heart disease, any medical condition that requires hospitalization, brain problems, orthopedic or bone-related condition, kidney disease, paralysis, coma, hepatitis, congenital conditions, and high-risk pregnancies. Now, these conditions has to be declared no matter how big your group is for the insurance company to understand what's coming. Now, going back to the pre-existing condition declaration, again, if you went to a doctor, if you're going to go to a doctor and have yourself checked up, and the doctor found out that there's one condition in the past that maybe you didn't know or you didn't declare in the medical application form, that this condition can be declined. Now, we always tell the customers that, or clients, that the medical application form has to be answered with full honesty. Otherwise, again, non-coverage will be at higher risk. Related medical reports, that includes a treatment plan and medication. Now, this point, I always tell the clients to submit if they've got the pre-existing condition to make sure that whatever they require within their condition will be covered. So it's best to advise the clients to state the medications, especially the ones with the maintenance medications, to include it in the application form and the medical reports. Full wellness check, again, for overage members. Some of the clients, like when they're at 50s, 60s, some 70s, they're saying that they don't have any condition. Maybe that's true, good for them. But insurance, again, works at risk. And these people are the ones who are at high risk to have an acute condition that's going to turn out to a chronic condition. That's why before they take out the policy, a full wellness check will be requested. Now, full wellness check, they'd be asked for some ECG or heart check. They'd be asked for cholesterol and sugar test. And again, premium will increase based on the condition and its risks. These are your underwriting guidelines. Just so you know, insurance companies calculate the loading based on the shared reports and treatment plan. Insurance companies' underwriters, which are mostly doctors and health professionals, calculate the risk and worst case scenario and how much the member will possibly claim due to the declared condition. Also, insurance companies will always be thinking of the worst case scenario and calculate it against how much do they need to charge you, and they'll be putting loading on the like basic premium. Have you guys gone into like an all-you-can-eat restaurant? Just to explain why insurance companies calculate it based on how much you're going to be spending or utilizing the policy. If you guys notice, there is always a sign saying no take away. Imagine you and your friends go to an all-you-can-eat restaurant and bring lunch boxes. After you eat a lot, you bring some home. The business will definitely fall. Usually, these businesses calculate and assume the average cost a customer will eat, then charge accordingly. Same with insurance. So you take out a policy, and the insurance company will calculate how much on an average you will spend or you will utilize the policy, be it you have pre-existing condition or not, and charge you accordingly. Insurance is a business that works based on risks, whether motor, general property, and medical insurance. They wouldn't allow for the company to lose, especially when they know what's coming. They would protect themselves while providing a logical and fair premium loading. Now, as it is mandatory, the government or the insurance company will sometimes revise the cover. Sometimes you'll be having on an average 1,000,000 dirhams for a clean application. Now, the insurance companies, once they find out that there's a massive claim coming in and they wouldn't like to add loading of 1,000,000 or 500,000 in your policy. Now, what they're going to do is they'll decrease the cover, they'll decrease the limit and benefits. So sometimes if it's 1,000,000 dirham annual limit, because that's annual limit, by the way, is the amount that you can utilize throughout the year of the policy. Now, for them to not charge you as much, they will decrease it sometimes to 500,000, 250,000. Some insurance companies can decrease it to 150,000, just to provide you a fair premium loading. And it's marketing strategy as well for them to entice customers to get into the product. Sometimes they decrease the limit or the benefits, or most of the time also the co-insurance. So instead of you going to a doctor getting a nil or no co-insurance, they sometimes put 20, 30, 40% co-insurance to decrease the loading and provide you somewhat a fair price. This is to control and provide, again, a feasible offer and to lure customers, and to provide the benefit, again, as it is mandatory to cover pre-existing conditions. Now, pre-existing conditions are, again, sometimes known and unknown. I'd say, for example, if somebody didn't declare a pre-existing condition and this member went to a clinic, complained about something that's not exactly the pre-existing condition, however, it's somehow connected to that pre-existing condition, that won't be covered as well. Now, whatever symptoms, conditions, illnesses, or injuries that you've had before you joined the policy that is related to any undeclared pre-existing condition will not be covered. I put up some examples for you guys to easier understand. Say, if you injured your leg before, taking out your policy and you require a physiotherapy after the policy started, and you didn't declare the injury, that's not going to be covered. A heart condition that started before the policy began and you require medication or treatment after, obviously this won't be covered if not declared. Another great example is if you complain about a scar that doesn't heal, however, you did not declare that you've got diabetes. Now, if you guys don't know, if you have diabetes, you tend to have longer time to heal. Now, the scar treatment won't be covered because the complaint is related to your undeclared pre-existing condition, which is diabetes. Now, how can be a pre-existing condition covered? So first, the one that I've discussed earlier, you have to declare it, provide full medical underwriting application form, provide reports and medications. If you're in a medical history disregarding group policies, or where a pre-existing condition develops into an emergency condition or life-threatening. So for example, you did not declare a pre-existing condition because you want to save money, and in the middle of the policy you had a heart attack, you were rushed to an emergency room, well, you need to be treated because it's life-threatening. As per the Health Authority rule, even if you didn't declare it, if it's an emergency or life-threatening condition, it should be covered. However, the coverage will just be until stabilization. So after you've been in the emergency room, maybe ICU after, if you're fully stabilized, like if your levels are stabilized and you are transferred to the ward or your private room, the coverage will stop. Basic insurance policies, especially for groups, it's also covered because they're not asking for any medical application form. However, 6 months waiting period for new applicants or a certificate of continuity without a gap cover is provided during addition. That pre-existing condition will be covered. Now, when is the best time to buy medical insurance? Well, when you're healthy without any complaints to maximize the benefits and continue security. Again, we buy medical insurance for a worst case scenario. You don't want to buy medical insurance when you have a problem, or any insurance actually. If you have a problem already, you don't want to buy an insurance because it's really going to be costly. So we recommend clients, even if they're not complaining about anything, I know it's mandatory, but it's best to get at least the best cover for them before the problem starts. Because if you guys don't know, if any condition, I'm not going to say it's a pre-existing condition, because if any condition happened in between the policy, if from acute to a chronic condition happened in between of the policy, it will be covered. Now, I put up some tips for us to review when providing information to clients, especially in terms of medical insurance. I'd like us to be proactive in posing the right questions during information gathering. Some of the things, or most of the things, clients come to us because they don't know about medical insurance. So you have to have your questions ready during information gathering to get the right answer and to advise properly. Be empathetic to clients and show concern when a pre-existing condition is being discussed. I know for us, sometimes it's just an added premium, but for clients, especially chronic conditions, these are one of their lifelong issues. So be empathetic. It's an issue for them and they want it covered. So be in their shoes somehow. Ensure accurate information is provided to the clients regarding coverage and non-coverage if pre-existing condition is declared or not. Some clients wants to take risk. They don't want to declare their pre-existing condition because they know what's coming. They're gonna lie about it, go on with the policy, but in the middle of it, I mean, you'll never know when you'll have an attack. So you have to be sure, you have to be accurate in providing information if it's going to be covered or not. Be resilient. Submitting pre-existing condition reports application form is easy, but when you receive that code from the insurance company, sometimes it's just nerve-wracking. So be resilient and contest unjust loading and check with other providers when increase is not realistic. Of course, again, having that value of empathy, you have to give your clients some fair deal or some fair premium for them to to appreciate what we're doing for them. So don't just receive the quote, high loading, send it to the client. You can always contest and you can always explain to the insurance company what's really required. And of course, constant communication is key to provide clarity and avoid negative repercussions and promote positive outcomes with clients. That's about it. A quick brief about pre-existing conditions. If you guys have any question, just let me know. I'll be happy to address. Julia's got a question, of course. Okay, so Julia's asking, so COVID doesn't have to be declared. Well, COVID-19 coverage in the UAE is covered. It's mandatory. Well, I'd say specifically in Dubai. Just so you guys know, any epidemic or pandemic is part of the exclusion in medical insurance. Whichever medical insurance you take in, uh, epidemic and pandemic is not covered. However, the Health Authority flip it over and force insurance companies to cover it. Now, if you've got COVID-19, I know it's an acute condition. It really doesn't have to be declared, but I would recommend you do because these conditions can lead to a chronic condition. So it's always best to declare it. Otherwise, if any related problems that was connected to COVID-19 happen in the middle of the policy, it won't be covered. So I would recommend you do declare COVID-19. But there are cases that insurance companies don't load as much for COVID cases. Hassan asked, what is the best way to avoid loading on pre-existing condition? There is no way to avoid loading in a pre-existing condition. But in my opinion, if it's a mild pre-existing condition, I'd provide all of the reports because some clients like they have diabetes or hypertension, but you're saying it's controlled. So you provide that information from your treating doctor stating that it's controlled, that you're under these medications only. With the reports, you'd still have loading, but it's not as much as if you're not going to be providing the correct reports. Again, insurance companies will always expect the worst if you didn't provide complete information. So you provide the complete information, you'll be covered completely, and you'll be loaded fairly. Another question from Ms. Muniba. What if a person had a condition years back which was sorted, but now if something happens to him because of that, would it be considered as a pre-existing condition or new? Very good question, Muniba. I'd say it has to be declared as well. Whatever the condition that is, it has to be declared, because if it happens along the way, I've got few clients like that. Like they've had nose injuries in the past and it was sorted, and then like 5 years, 6 years later, some problems within their nose happened. And these insurance companies somehow connected it to that nose injury in the past, which he didn't declare. Now, this surgery for his nose this time is not covered as well. So I would recommend you still declare it a pre-existing condition. Isana's got a question, another question, a good one. What if a client is having a pre-existing condition and he did not declare? Is there a turnaround time for that to be covered in his insurance? Now, if you did not declare a pre-existing condition, whatever symptoms, illness, or injuries related to that will not be covered. Now, if you want that to be covered, some insurance companies will accept reports for them to reevaluate and include it in the policy. However, the loading will be there. You have to pay the loading for them to cover it in the middle of the policy. Otherwise, again, if you didn't declare, it's not going to be covered. Rebecca's got a question. If a pre-existing condition is declared in the middle of the policy as the member was not aware at the time of the policy issuance, what is the procedure and will it be covered? Yep, I just answered that question. So we tell the insurance company and we provide them the reports, and they will underwrite and recode accordingly, and that will be covered if you agreed on the loading. Mr. Ramsey has got a good question. So if a client is from Fujairah or a resident of Northern Emirates but live in Dubai, do the DHA rules of PEC apply? Most of the insurance plans that's being offered to Northern Emirates is DHA compliant. So PEC rules for DHA or Dubai would also be applied. There's not much of plans that's being offered in the Northern Emirates specifically. Now, if you're going to be taking out a Northern Emirates insurance policy, because you've got a Fujairah visa, in Northern Emirates, there's a different set of pre-existing condition guidelines. Some insurance companies will provide 1 year waiting period. Some insurance companies will provide 2 years waiting period. So again, that would depend on which policy you took out. If you got a DHA policy, DHA rules will apply, even if your visa's Northern Emirates. But if you took out a Northern Emirates policy, different pre-existing condition will apply. Because in Northern Emirates, also for your information, these coverage are still not mandatory. Okay, Another question from Mr. Ramsey. Good one. Can I exclude PEC? If you're going to be taking out DHA or even HAAD policies, you can deny it. They'll not cover, but you cannot exclude it. Again, it's mandatory uh, as per Dubai Health Authority rule that pre-existing conditions must be covered. So you cannot you cannot declare and request for it not to be covered. Insurance companies has to cover it one way or the other. So you declare it, it's going to be covered. If you won't, it won't be covered. Another question, I guess, from Adnan. What is the best possible way to avoid waiting period on individual basic insurance while switching? Best possible way is providing a certificate of continuity. Again, in Dubai, especially in Dubai and in Abu Dhabi, insurance has been mandatory for a year, a couple of years maybe. So you must have an insurance before you took out the policy. So you provide a certificate of continuity included in your application, and they'll waive your 6 months waiting period. Otherwise, 6 months waiting period will apply. Now, how can you tell if a client is lying? Well, this will be human nature kind of thing. I mean, you can get a feeling that they kept on. I mean, you really cannot judge a client with his words, but most cases, in my experience, like if a client kept on asking about some specific coverage and they kept on saying that they don't have any pre-existing condition, again, I don't want to be judgmental, but in my opinion, they can be lying. So you have to be clear to the clients that whatever pre-existing condition or any condition they had in the past, that has to be declared, otherwise will not be covered. And if they still insist that they didn't have it, as long as you made yourself clear that these has to be declared, you'll be on the safe side. How do you deal with it? So again, you have to be accurate, you have to be specific, and communicate to the clients that any condition in the past has to be declared. If they still insist on denying, again, it's up to them. Another question. What is the worst case scenario if you don't declare? If you're non-Dubai or non-Abu Dhabi, what is the worst case scenario if you don't declare a pre-existing condition if you're non-Dubai or non-Abu Dhabi? So if you don't declare worst case scenarios, it's not going to be covered. I mean, I'll just go straight up. It's not going to be covered. If something happens related to it, it's not going to be covered if you did not declare. But again, if it turns out an emergency, it will be declared. It will be covered. Sorry. there's another question. If a woman is pregnant, how much? Just can see the whole question. Maybe how much is the loading? That would depend on few things. If it's a complicated pregnancy or a normal pregnancy. Also, how much is the annual limit for maternity for that specific policy? I've gotten experience. I'm sure you guys know MedNet or heard about MedNet. It's a green plan. The annual limit is 10,000 dirhams. And this client, she's pregnant for a couple of months. I receive a loading of 8,000 dirhams. Nowadays, I'd say safe like 10,000 to 15,000 dirhams loading if somebody's pregnant. But again, it would depend on the reports, if it's complicated or normal. If it's a single or a twin, it all goes down to underwriting. Oh, continuation of that question. I like this as well. Again, how much the loading? I hope I answered that question. And do you recommend the extra premium and why? What are the benefits for the pregnant women? Couple of things. Like pregnancy or delivery will cost the client, say for example, if they go to Al Zahara hospital, based on experience, the cost of maternity in total will be 15,000 to 20,000 dirhams. If you take out a policy with 25,000 dirhams maternity benefit or delivery expense benefit, insurance companies will charge the member, the client, I'd say 25 to 30,000 dirhams extra. It's higher than what the client will pay if they didn't get an insurance and just pay out of pocket. But in my strong opinion, I'd still recommend for them to take out a policy, declare the condition, and pay the extra loading. If you can ask me why, there's just one thing. Again, you're taking out medical insurance for the worst case scenario. I know some people can pay for the maternity out of pocket, but what if any complication happens? What if an emergency happens? What if another procedure needs to be done during the maternity or even after it? Now, these will be covered under the medical insurance policy up to your annual limit. Some annual limit will be 500,000, a million dirhams. Now, this can cost you much more if you're not going to declare it and just pay for the maternity, because their packages are just up until the baby's out of the mother. So if that's like the best case scenario, 15 to 20,000 dirhams. But your worst case scenario, you'll never know. So if paying 10,000, 8,000 dirham extra, I'd say that will be worth it. And I would recommend they declare. In basic insurance, is there a waiting period to cover maternity? Now, this is a tricky question. For basic insurance, there'd be 6 months waiting period for maternity. Now, for basic insurance, you can also declare maternity, and if you declare it, you'll add a bit of a premium to it, and waiting period will be waived. And loading will be like 7 to 10,000 dirhams as well, based on the annual limit. Okay, I guess that's about it. Hold on, just checking the other questions. I think that's about it. If you have any questions, just give it a go. Just let me know. Otherwise, let's go with the polls.
This was the final poll question. I think that is it. I believe we can wrap up the session now. Thank you, Charles. It was an educating session and a nice presentation as well. It was well explained and the Q&A was brainstorming. I appreciate your efforts, and if anyone has any further question, please reach out to Charles directly or send an email either to Charles or me. Thank you for attending the webinar, guys. Have a nice day, everyone.